Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Please subscribe to our Scripps Health YouTube channel. We've got great information for you featuring the latest technology, our stellar doctors, and inspiring patient stories. Okay, it's 2 a.m. You are wide awake. You can't sleep. You have been tossing and turning since midnight. According to the Centers for Disease Control and Prevention, you need at least 7 hours of sleep each night, and on any given night, 35% of the population is sleep deprived. Joining us to talk about sleep issues is Dr. Stephen Poceta, who is a neurologist and sleep medicine specialist at the Scripps Clinic Viterbi Family Sleep Center, and Dr. Derek Loewy, who is a clinical psychologist and sleep medicine specialist at Scripps Clinic. Thank you both for joining us.
Great to be here.
Why do we need a minimum of 7 hours of sleep each night? Why is sleep so important?
Well, maybe the easiest answer is because that's how we feel our best. We get restored, we're more productive, and it just feels good. And of course, you need that much sleep for long-term health benefits as well.
And does it need to be 7 hours of uninterrupted sleep? I mean, what about the people who might, wake up 2 or 3 times a night?
Well, some wake-ups in the night are really normal. Especially as we get older, you're going to wake up more. Very few people sleep solidly for 7 to 8 hours straight. So a couple of wake-ups here and there, bathroom breaks are not unexpected, and that's fine. You need that 7 to 9 hours of possible sleep time, bedtime.
And what if we don't get that 7 hours of sleep a night? What kind of health issues does that lead to?
Well, first it leads to feeling tired or sleepy the next day. It depends a little bit on why you're not getting the 7 to 8 hours. If it's that you're working 2 jobs and you're only in bed for 5 hours, that's a little different than like having a sleep disorder.
So what's the difference between a sleep issue and a sleep disorder?
Yeah, some people view insomnia, difficulty sleeping, as maybe not really a sleep disease or disorder, but just a feature of lifestyle and the human condition and worrying and thinking about things. But it is important that you're giving yourself the opportunity to sleep and rest for 7 to 9 hours.
So can you give us an example, though, of insomnia you can't sleep? What are some sleep disorders?
Well, when insomnia becomes chronic and perpetual and the person's done everything they can do and they're still sleeping maybe only 5 hours a night despite adequate opportunity to sleep, then we would say that is a sleep disorder. We would call that insomnia. Other disorders that cause wakefulness in the night are restless leg syndromes, even sleep apnea, for example.
So what is restless leg syndrome?
Restless legs is a specific condition where the people feel really an unpleasant feeling in their legs that makes them want to move around, and that is what's keeping them awake.
So is it the leg just like trembling, or is it the leg jutting out like this that actually wakes you up?
All of the above, yeah. A lot of times it's just a bad feeling, a little trembling, a little tingling, but certainly a restlessness that makes you move. The leg might jerk on its own. So that's an example of a specific sleep disorder contributing to insomnia.
And what about sleep apnea? What is that?
Sleep apnea is a difficulty breathing through the throat at night, people that snore heavily, and that snoring then interrupts their sleep and wakes them up.
And if you do not get adequate amounts of sleep at night, what kind of health issues does it lead to? Just kind of laundry list them for us.
Yeah, well, again, the first is feeling tired the next day and or sleepy. That can lead to car accidents, poor performance. But also in the long run, increased chances of high blood pressure, certain other conditions, even to some extent cancer is more common in shift workers, for example.
Really?
Yeah.
Why would lack of sleep cause cancer?
Well, we don't really know the underlying reason that we sleep, right? It certainly is to restore our brains and restore our body. So there is a certain restorative part of sleep, and when that's disrupted, there are long-term negative consequences for health.
And so you said high blood pressure, diabetes?
Diabetes, certainly in some sleep disorders.
Obesity?
Yeah. Obesity is well linked to people that often are not giving themselves adequate opportunity to sleep. So think the person that is up till midnight, has to get up then at 6 a.m. That person is at increased risk of gaining weight.
Heart disease?
Heart disease directly and indirectly through sleep apnea, yeah.
Stroke?
Stroke with sleep apnea, stroke is a long-term consequence of that too.
Mental distress?
Certainly anxiety goes with insomnia and difficulty sleeping. Again, here it's a little bit important to distinguish, are we talking about risk from a sleep disorder like sleep apnea, or risk from anxiety of being awake at night, or risk from only being in bed for 5 hours? So they're a little bit different.
And what about dementia?
Dementia is more and more linked to inadequate sleep, be it from sleep apnea or decreased sleep length. In fact, probably the leading theory as to why we sleep is to clear metabolic byproducts from the brain, so that it's only during sleep that the brain can kind of clear itself out of some of these products. And in theory, at least right now, not adequate amount of sleep leads to buildup of some of these negative byproducts.
So if you have sleep apnea, you have problems breathing while you're sleeping, how do you treat that?
That's treated by keeping the upper airway open with CPAP, oral applied.
What's a CPAP?
CPAP's a little device under the nose connected to a small machine. It's kind of cute, about that big, and it blows air in the nose to keep the throat open so the person breathes better, sleeps better, feels better.
Why aren't people getting enough sleep? I mean, what causes poor sleep? Is it because of things beyond our control, or is it because of things like this? Because we're, keeping ourselves up at night with electronic devices.
It's a combination of things. Certainly lifestyle plays a role. And if you think about technology these days, our unlimited access to our devices, our phones, our tablets and computers, etc., there's a lot more opportunity to be engaged with this technology at what might be considered inappropriate hours. For example, too close to bedtime, or in the middle of the night if you can't sleep. And this can have two negative impacts on sleep. One is light emanating from these devices has the potential to suppress your natural melatonin, which is the sleep hormone you need to fall asleep and maintain sleep. So your brain interprets the light signal from these devices basically as being the sun is up, it's time to wake up. The other potential risk of these devices is that the content of what you're looking at can keep you awake. So if you're engaged in watching your favorite Netflix show, or you're checking the news or doing work email, that's keeping you mentally stimulated and is probably preventing you from relaxing into a sound sleep.
What about alcohol, caffeine, a large meal before bed?
All of those can play a role to a certain degree. Caffeine has a rather long half-life of about 6 hours. It stays in, that's the time it takes for half it to be eliminated. So caffeine late in the day for some people who are sensitive to it can make it hard to fall asleep. My rule of thumb is keep your caffeine to before lunchtime to be safe. Alcohol can have two different effects. It can help you fall asleep more effectively because it's a central nervous system depressant. However, it gets metabolized pretty quickly and people are prone to waking up in the middle of the night when having a restless sleep from that point forward. So a couple of glasses of wine in the evening with dinner shouldn't be a problem, but too much consumption too close to bedtime may have a disruptive effect.
Large meal before going to bed?
Seems like a bad idea in general because of a chance of reflux from the stomach irritating the esophagus. I don't think we know too much about any direct effect of food on sleep.
And what about exercise in the evening before bed? Is that a good or a bad thing?
Well, I'm going to give that one to Derek on exercise before bed.
Well, I think we all know that exercise as a general rule is a good thing,
Good thing, yeah.
for health and well-being. With respect to sleep, it's probably not a bad idea to wind down any vigorous exercise at least 3 hours before your plan to go to sleep. Probably the best time to exercise in the day, if you have the time, is first thing in the morning. We often recommend going for a morning walk or going for a morning workout in association with a lot of bright light. Those two events, physical activity and light in the morning, are a great signal to your internal sleep clock that this marks the beginning of the waking part of your cycle, and that will have an impact on when you fall asleep that night. So we always recommend light and occasionally exercise in the morning to keep the internal sleep clock running on time.
Okay. So we want you to hold this thought, because coming up we're going to actually give you a bunch of ways to improve your sleep. So get a pen and a paper ready. We'll give you tips and all kinds of fun things on ways to help you get some sleep. So hold that thought. That's coming up in just a couple of minutes. There's lots of medications out there to help improve your sleep. What are they? And what are the benefits and what are the risks?
Well, speaking broadly, the over-the-counter sleeping aids, Benadryl and some other antihistamines, we generally recommend avoiding them. They're linked with long-term health consequences as well, and they don't really work that well for most people.
Such health consequences such as what?
The antihistamine and anticholinergic medicines have recently been associated with risk of dementia.
Wow.
But most people figure that out, that they feel spacey and tired in the morning if they take Benadryl at bedtime or one of the so-called PM medicines. But there are a number of supplements that we generally think are safe and can be effective. Melatonin at the right time of day and in the right dose can help. GABA is recommended. Valerian is one of the over-the-counter. Magnesium is pretty popular right now as a sleep aid. So there's a number of supplements that we think are safe and might be effective for people.
But what about actual sleep medications?
Yeah, so prescription sleeping pills are considered a last resort now, really. Most of them are habit forming. Most of them don't work as well over time. There are some people that do benefit from prescription sleeping pills, and there's sort of a middle ground. There's a few sedatives approved by the FDA that are not habit forming. They're not in that Valium, Ambien family, and those can be safely prescribed and used by people.
What would the names of those be?
Silanor is one, a form of doxepin, and mirtazapine is another commonly prescribed one, trazodone, amitriptyline. Those are medicines that we believe are safe and reasonably effective for long-term use.
But that's obviously a lengthy conversation you need to have with your doctor about those.
Yeah, that would be the risk of the sleeping pill versus the benefits, and also to be sure that people are doing all the other things right in their lifestyle. It's not a good idea to use a sleeping pill just to make you sleep at a certain time if you're also ingesting caffeine too late and drinking too late and keeping an irregular schedule.
Well, let's go back to you, Dr. Loewy. What about changing your behavior to treat insomnia, for example? What kind of things should you do to help you go to sleep and stay asleep?
Well, my practice at Scripps involves something called cognitive behavioral therapy for insomnia, or CBT-I. And this is a pretty well established method for helping people sleep better non-pharmacologically. And within the context of our group at Scripps, we try to steer people away from sleeping pills when possible, as Steve said. Sure. More often than not, though, people come to see me in the insomnia clinic who are already taking something. And I would say 90% of the people who are on something would rather not, but they need to sleep. And so they're in this risk-benefit analysis about, should I take the pill? I'd rather not, but I have to sleep to function during the day. And so they're kind of trapped. And what CBT-I allows is an opportunity to bring to bear knowledge and wisdom about how human beings sleep in such a way that we can augment or enhance their natural sleep ability, which would then allow them to gradually wean off the medication. What happens is many times they'll experiment themselves by going off their medication for a night or two to test how they can sleep. And if they've been on these things for a long time, guess what happens?
Doesn't work very well.
It doesn't work. Those first couple nights are horrible. And that reinforces their belief that they can't sleep without the drug. That is both true and false. Certainly true those first couple of nights, but in the long term false. Their natural sleep system is still there. It still resides within them, but it's been weakened over time because the medication's doing the work. It's like a muscle you don't exercise. It doesn't go away, but in a moment's notice, if there's no pill, it can't step up and save the night. So CBT-I strengthens that natural sleep muscle through sleep scheduling, light therapy, managing cognitive arousal and anxiety at night so that their sleep muscle is working again. And once we see evidence of that, then we turn our attention to the medication and introduce a tapering program. It's a very successful approach.
How long does it take, that kind of therapy?
Depends on the person, depends on how many meds they're taking, the dosages, how anxious they are, how compliant they are with the recommendations. That's huge, because we do ask them to do a few things that are outside their comfort zone, but if they're motivated for the change, they're usually pretty adherent. I would say Probably we can get people off their medication in 4 to 8 weeks, depending.
When you're a baby, you can go to sleep in 30 seconds. Same thing when you're a teenager. Why does sleep become such a precious commodity as you get older?
Well, I often say sleep is natural. If you stay up long enough or you're a child, you will fall asleep naturally and easily. But over time, sleep is also a learned behavior. We learn that the blanket or the pacifier, the lullaby, this means go to sleep. And unfortunately, many people develop problems in life, stresses in life. Maybe they've got a baby, maybe it's a good stress, they got to be up at night. But now they start to worry about how am I going to perform the next day. And then the brain learns that when I want to fall asleep, I can't. It's like we call it a conditioned response. So we think a lot of insomnia now is a conditioned response. The brain is in the habit of not sleeping when it otherwise would sleep. And that overrides the natural sleep tendency.
But what about, for example, women who are, have gone through menopause? Is it harder for them to sleep?
Yes, I mean, I think
So
any woman would
postmenopause?
say, well, perimenopausal symptoms and then postmenopausal decreased estrogen state absolutely worsens sleep. And they really need an approach to help them sleep that does not involve medicines, and then sometimes an approach that might involve medicines. The combination is what's most effective.
And what about shift workers, folks who work the night shift, let's say till midnight, or folks who have to get up at 3 a.m. to go to work?
Well, sleep is very adaptable. I mean, sleep does allow us to be stressed out and still function the next day. Sleep does allow us to, say, rummage around to find food and stay awake to fight the bad guys, and sleep system can deal with it. So occasionally, getting up at 3 a.m. is okay. Chronic shift workers, some people adapt a lot better than others, but there is no easy answer to how to deal with shift work. Very difficult.
And is there a genetic component? Let's say that your parents were poor sleepers. Will you end up being a poor sleeper?
I think the data show that.
Yeah, there is a tendency, I think, for insomnia to be familial. I have
Passed on, great.
Yes, thanks Mom, thanks Dad. Patients who've had insomnia problems since early childhood and have a family history of something similar, we kind of think that maybe there's a genetic component. But I think most insomnias are kind of learned inadvertently as a function of life. Stress and different things we go through can derail our sleep. And we can often develop what Steve was talking about, a conditioned association with arousal at bedtime. How many times have I heard the patient say, I feel sleepy watching TV in the living room, but as soon as I go into that bedroom, I'm wide awake. And it's mystifying to them because they're the same sleep-deprived person 5 minutes ago in that room, but now they're awake in this room. And we talk about that in terms of conditioning. Your bedroom is where you've had all your suffering with your insomnia. That's where your fight or flight system is getting triggered when you go into that room. In the living room, nothing bad has happened to you there. And you're relaxing at the end of a long day, sleep comes to find you. You go to bed, now it's showtime. And there's a pressure, an internal pressure to sleep and perform, and it goes sideways.
And that's when you start thinking about all the things you need to do to get ready for the next day, or
right.
projects.
And then it snowballs on them.
Right, and then you have to pick up the phone, right? Because you need to answer a couple of emails that you forgot about. So it's kind of a vicious cycle, isn't it?
Right, but you're not supposed to be doing that.
Right.
That's
So
sleep therapy
so
101.
So you leave the phone in the living room. You don't even take it into the bedroom.
You can take it in the bedroom if you want, but we don't look at it. The other thing that's even more insidious than the phone is having the alarm clock staring you in the face when you can't sleep all night. Recommend don't be a clock checker at night. Clock is not helpful.
So let's say you have sleep problems. Talk about the Scripps Clinic Viterbi Family Sleep Center at Scripps Green Hospital in La Jolla. What goes on there?
Well, we have a lot of practitioners, doctors, nurse practitioners, psychologists. We really have a comprehensive sleep center, and I'm pretty proud of it. We evaluate and treat all kinds of sleep disorders. Speaking of families, one kind of sleep disorder that runs in families is the tendency to be a morning person or a night owl. That's another common aspect that we have to assess. If the person, for example, can't fall asleep till 2 a.m., but they sleep till noon on weekends, well, that's a timing issue. And we have a couple of doctors, Dr. Loewy is one, who specifically deal with circadian rhythm disorders. All the way from circadian rhythm disorders to narcolepsy, restless legs, sleep apnea,
what's narcolepsy?
insomnia. Narcolepsy is a brain chemical abnormality that comes on in the 20s usually, where people are excessively sleepy all day and they really cannot stay awake even though they did sleep all night. So narcolepsy is a brain condition.
So when they come into the sleep center, you wire folks up, they spend the night. What do you do there?
Well, we always have them see one of the doctors first to see if a sleep test is necessary. Sometimes it is, sometimes it's not, and then we can do sleep testing at home, sleep testing in the sleep center with wires and monitors on. We have a device that's sort of like a Fitbit that can give us information. So the testing is whatever is necessary for that individual person.
To see if they get down to deep sleep, light sleep,
To see if their
they've got
sleep,
breathing problems.
see if there's breathing problems, see if there's leg movement problems, see if their awareness and ideas of their sleep sort of matches what we can see on the brain waves. That's an important aspect.
Okay.
So.
So we referenced this a couple of minutes ago. Let's come back now and talk about this. Talk about a bunch of ways that you can actually improve your sleep. What steps can you take?
One thing that's very important, maintain a consistent morning wake-up time and complement that with getting light. Bright sunlight in the morning combined with a consistent wake-up is the anchor point for your internal sleep rhythm.
So if you wake up every weekday at 6:30 in the morning, you're saying get up at 6:30 in the morning on the weekend?
I usually give people a bit of a break with that. I'll give them an extra hour in bed because I don't want to be cruel, but it shouldn't be a wide discrepancy.
Okay.
So that's one. And on the bedtime side, patients will always say, I'm told to keep a regular bedtime. Well, you can't predict when you're going to fall asleep, so sometimes that can be a little bit tricky. My recommendation on bedtime is go to bed when you feel sleepy. Not tired, bored, or fatigued, sleepy. That's when your body's knocking on the door saying, okay, it's time to go to bed. Don't artificially put yourself to bed prematurely. You're just going to set yourself up for a long time waiting, and that creates more conditioned arousal and frustration. So sleepy bedtime, regular morning wake up. And we already talked about this one, no clock checking at night. Don't suffer your insomnia in bed. Give yourself a chance to fall asleep, or if you wake up, give yourself a chance to fall back to sleep. But if it starts to prolong and you're getting restless, agitated, angry, leave. Go somewhere else, do something distracting and relaxing, read a book. When you feel more centered, come back and try again. But don't suffer your insomnia in bed because those negative feelings will start to get automatically associated with that room. And I've had people tell me they dread their bed, they hate bedtime, they hate nighttime. That's a deep hole to come out of. And to prevent that, you don't want to suffer in bed.
Okay. And then what about electronic devices? When should you stop using them? How long before you go to sleep?
I usually tell people to turn off their screens about an hour before their intended bedtime. Because it's usually about an hour before you fall asleep where your melatonin is starting to get secreted. And so, the reality of the situation is you can tell people to turn off their devices in the evening, but they're not going to do it. Similarly, students who have to do homework on computers, they have to do what they have to do. So you try to create a buffer, maybe no electronics for an hour before bed, and that's a good time to read or do something that's non-technology based.
And the yellow shift is good too, right? Avoiding the blue and using the yellow apps if you do have
Yes.
to be on your screens in the evening.
Good point.
Say that again?
So blue light is more arousing. Blue light suppresses melatonin better. So most of the phones or devices have apps to minimize the blue and enhance the yellow. That's less stimulating to the body.
Interesting.
So in the evening, yellow light is generally better.
And you can find that in your device settings for display. Just look for the blue filter setting and you can tell it when to turn off and turn on, and that will help protect the melatonin.
And alcohol, once again, don't drink after.
Dinner time, really.
Okay.
3-4
Yeah.
hours before bed.
Yeah,
All right. And then exercise, major exercises in the daylight hours.
yes. But if the only time to work out is after work, so be it. Just don't, do an intensive workout too close to bedtime. Give yourself a couple hours.
And making sure your room is quiet and dark.
Dark, cool, quiet bedrooms usually make for the best sleep.
Okay.
Not always achievable. There's pets, there's noisy neighbors, there's snoring bed partners, which is a huge one. So we try to sift through as much of that as we can.
Wasn't there a study which said that actually you sleep better if you have a pet in the bed with you, sleeping
That
up
study,
against you?
Did you publish
that study,
that one?
I don't know,
No?
but definitely
I had read something about that.
A lot of studies show the bed partner of a sleep apnea patient sleeps worse. So the environment, snoring really are something to deal with. Of course, our brain adapts so that we don't hear the train every time after a while, but things in the bedroom that are loud can be a real problem.
And what about meditation or breathing exercises, relaxation exercises?
I think those are important as an add-on to the overall sleep program. In and of itself, it won't put you to sleep, but meditating can reduce stress, reduce heart rate, relax you, and enhance the ability of your sleep to come out.
So stop watching TV, put away the electronic devices. An hour before you go to bed, do your meditation exercises, breathing exercises then.
And it also helps to have a routine. So something sort of consistent. In the same way we sleep train our young children, the evening routine before bed is consistent. And so part of them is actually anticipating the onset of sleep. Adults respond to the same kinds of cues. And so an evening ritual that includes relaxation without technology that's consistent can be very helpful.
So the bottom line is you actually can do things to improve your sleep.
No question.
Oh yeah, and I think to emphasize that morning wake-up time and some morning light is the anchor point for the entire 24 hours. So you take that wake-up time and you subtract 7 hours, and that's probably about your estimated
That's your bedtime.
Okay.
Yeah.
And if you don't get a handle on your sleep, what happens?
I mean, what should you do about it, or what are the consequences?
Both.
Well, in the short term, the consequences are annoying. You're going to have a rough day at work, you're going to be irritable, you're going to be tired. Long term, if it doesn't get resolved either spontaneously or through some approach, it has the potential to develop a chronic condition, and that's where we get into this place of concern about long-term consequences.
And it's a little funny because sleep is kind of Zen-like. It comes passively to you. You want to do what you can to help it, but you can't worry about it and freak out about it because then you're in a negative cycle. So there's a lot we still don't understand about sleep and how to sleep better, but all the things that we've said are really solid and should be able to help people.
Any final thoughts?
If you can't sleep, don't try too hard. People don't go to sleep. People fall asleep. Sleep's a passive behavior. It's people who are not sleeping well that try to make it happen, and it's the trying that makes it worse.
Anything else, Dr. Poceta?
No, this is good. I think I'm going to sleep better tonight, hearing all this.
I think we all will. Thank you both so much. We appreciate it. If you'd like more information on how to get a good night's sleep, please click on the link or go to scripps.org/videos. Want more critical information about your health? We take care of you from head to toe. Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us. It's our mission at Scripps to help you heal, enhance, even save your life.